Hello, everyone. My name is Jen Braun, and I direct the AHA Team Training Program. Welcome to our September webinar on suicide and mental health and healthcare teams. This is a very important and timely webinar as September is National Suicide Prevention Month. So we've come here to unite, to promote awareness and share strategies for mental health and suicide prevention among our own healthcare teams. Before I hand it off to our speaker today, I'm going to go through a few rules of engagement and announcements. So you can access audio by listening in through your computer speakers or through your phone. If you're having any issues, you should be able to access the toolbar at the bottom of your screen to switch to either phone audio or computer audio based on what you're currently using. Please note that you're in a listen-only mode throughout this presentation, and I will moderate a Q&A session at the end with our speaker. So if you have any questions, please chat them in as they come to your mind throughout the presentation. If it's technical or logistical, we will answer it in the moment, but if it's for our speaker, we'll save it for the end. And then finally, please note that the presentation is being recorded, and we will notify all registrants when the recording is up on our website, in case you want to share this with others. So as always, we're happy to offer free continuing education credit for our webinars. So in order to claim your CE credit, you must create a Duke OneLink account. Duke is one of our helps us provide our CEs. And this is a one-time only setup, and my colleague Kara has or will be chatting in those instructions. And you can also refer to the email that was sent to you this morning. Following the webinar today, please text the code ZEDMEY to the number you see there on the screen, and then we'll be sure to share this at the end as well. So in terms of our upcoming events, we have our course and workshop schedule here for the remainder of 2023. New this year is we are offering a 4-week Team Steps refresher course starting at the beginning of next month. And so this is really excellent for those who need a quick refresh on the tools, while also some coaching and support to better spread and sustain team steps. And so spots are filling up quickly, and we expect the course to be sold out. So you can secure your spots today. And then the remainder of our in-person master training courses are listed here as well. And so our master training courses are highly interactive, and we've purposefully structured it to include really significant work time so teams can walk away with both strategic and tactical implementation plans. So we have team discounts available as we really encourage you to attend with a team. And dates for 2024 courses will be announced within the next month or two. We have another webinar this month with a focus on behavioral health, sponsored by Array. So please register for that webinar on September 20th, and Kara will chat in all of the links as well. And then finally, if you're looking for a more customized training solution, we offer on-site trainings where we come to your organization to deliver anything from a 2-day Team Steps Master Training course to a more comprehensive program that can span multiple on-site trainings and coaching to really support your Team Steps implementation efforts. And so this allows us to customize the content to your audience and really meet you where you're at. And you can click on the Learn More button on your screen, or Kara will chat in the link where you can visit our website to complete a really brief questionnaire where one of our team members will follow up with you one-on-one to get started on a more customized solution. Okay, so enough of me. I'm really pleased to introduce our speaker today, Dr. Sanne Henninger. She's a Team Steps Master Trainer, has a wealth of experience surrounding mental and behavioral health, conflict management, team-based care. So you're in wonderful hands today. I'm really excited for you to get to hear from her. So Sanne, I will pass it over to you.
Absolutely. Thank you so much for having me. I was thinking as we were getting started, just how passionate I am about this topic. So I've been a mental health therapist for 20-something years, and a lot of those years were for healthcare workers specifically. And then I have worked team steps, customized team steps for Duke for so many years as well. So I am just so happy to be here, and I hope that in some way it impacts somebody out there that needs it. So thank you so much for having me. Just such a pleasure to be here. So just the objectives, I'm focusing a little less on statistics and a little more on how to look out for people who may be at risk on your healthcare teams. And so supporting, fostering coping skills, and then building some of those sort of prevention team connectors to prevent suicide and depression, and all that comes with that. So what I wanted to start with was just to get a little feel for where you are with a couple of simple questions. So first question being, do you know somebody in your workplace right now that you are concerned about? So, whether or not you're a leader or otherwise, do you have somebody that you're kind of thinking, wow, I'm just worried about that person's mental health and or potential suicidal ideation? So go ahead and answer. Kara is putting those up now. And she is going to share those results. The second question will be on a scale of 0 to 5, with 0 being low. How comfortable would you be if a colleague shared that they had suicidal ideation? So that is question number 2. And then question number 3 is, how likely do you think your staff would be personally to share their burnout or suicidal ideation right now? So meaning, would your staff comfortably come to you or another leader and talk about their mental health concerns? So Kara is going to share those results in a moment, and that just gives us and me a feel for where you are. Okay, so question number 1. Do you know somebody in your workplace? So a fair number said yes, so 31%. That's, to me, that is a high number. And the statistics show that 1 in 3, at least at one point in their careers in healthcare, have thought about it. Then we've got the scale of 0. How comfortable are you? So most of you fairly comfortable, but if there's anybody who's not comfortable or completely comfortable, then today's the day for us to talk about that and get you some answers. Okay, this is very helpful. How likely would your staff be comfortable? So kind of mid-range, and that is what we're talking about today, is how to get staff comfortable and skilled in kind of watching for each other, and also in knowing how to reach out. And that's one of our biggest preventions in healthcare, is how can we help people to be comfortable and psychologically safe in their environments to reach out. So thank you, Kara, and thank you everyone for responding. Gives us a good feel for where we are. Okay, so suicide trends. 1.7 million people in 2021 attempted suicide. It is the 11th leading cause of death. The trends are upward, and if they're not downward or 0, it's a concern. And particularly, as we know, stress, burnout, anxiety, depression is so high in healthcare. I probably don't need to go through the list of why that is, but you add together the stress, the the sadness that healthcare workers see, the difficult patients, the safety risks, all of the above cause that increased stress, burnout, anxiety, and depression in healthcare. So we want to be closely looking at our healthcare teams and finding ways to get them support and to build that psychological safety in our teams, to know what to do and how to support one another as well. I actually wanted to just throw out some of these wonderful resources, including American Hospital Association. They and CDC have put together an incredible toolkit. So I added these also. Some of you had asked about outpatient medical settings as well. So I found an incredible resource on that. So pretty much any questions you guys may have asked or anything I didn't think I would cover today, just based on scope. There are lots of fantastic resources here. Some of you had asked about first responder resources as well. So if you're kind of going through this presentation today and you're not getting a very specific answer to what you were looking for, please reach out to me directly, or AJ and our Kara and Jen, but just wanted to make sure you had all of these resources too. Okay, so let's dive into thinking about people and human beings and how that ties together with suicidal ideation and the ideas that we put together to protect our staff. So what are some of the human emotional needs that would, if they were met, would most protect against suicide? And you are just chat in, just would like to see how you guys see the most protective factors. So again, the question just meaning in someone's life, what might protect them from major depression or suicidal ideation? And that could be coping skills, family support, etc. So throw in your answers and let me take a look. Okay, thank you so much. So we have family support, feeling like they belong, supported, connections with family, psychological safety, knowing your resources. I'm just kind of reading off because this is the list. Having coping skills, basic needs met. We're going to look at a slide that shows that in a minute. Friends, friends at work, colleague and peer support. Huge part of what today is all about. Feeling as though we're cared about, feeling as though others care about you, feeling of community, connection. I think the themes are here. Sense of belonging, feeling of belonging. Yep, that comes up 4 or 5 times in a row. Beautiful. Spiritual connections, connection and spiritual support, feeling like things will get better. I also put in there, or think of it as sort of a sense of control. There we go, job security, someone to listen, to be loved, appreciation, sense of purpose. I think the themes have revealed themselves. And so yes, those seem simple. You guys answered that question so easily. What we may not always think about for ourselves personally or for our teams is how do we actually put that into people's lives. So I put together a slide you will probably recognize from psychology classes at some point in your careers if you don't sort of think about this way every day. So all of the sort of protective mechanisms that you mentioned, to me, fit beautifully on the Maslow's hierarchy of needs. And you think about just three years ago and even recently with COVID, physiological safety was not even present, which kept especially our healthcare workers on unsteady ground. So then we have safety, love, belonging, esteem, and self-actualization. The words on the left basically outline those that you said. And when we think about the contributors to burnout, all of that synthesized research shows that lack of purpose, lack of connection, lack of supporting one another. So I think that probably everybody on this call is aware of this. I do like to have people sort of think about it in organized models, because otherwise we just sort of say, yeah, we need to make sure people have meaning. But it gets a little more difficult to put it into practice when it's just sort of in our mind. So I love having things on models and as good reminders for as you're sort of thinking about your teams and some of those individuals you're concerned about, you could almost look at this list and say, where is my team lacking? Are they not feeling appreciated? Are they feeling nervous nervous about what they do. Or perhaps you're rounding on your team and you're trying to sort of think about where is the gap in psychological safety. This is a great model and sort of list of words that would synthesize those categories. So for today, again, wanted to give you sort of three main buckets: is supporting individuals at risk, how to identify, how to respond in personal conversations, and how to know exactly what to do in a more urgent situation. So we'll start there, and then we'll move on to the coping skills and building your team. So supporting your individual, we're going to think about identification of people to be concerned about, how to respond, and what resources to make sure you have on hand. One of the questions that was submitted was a question about sort of whether or not to ask staff questions about depression or suicide. And really the way to think about it, and without sort of getting into legal or policy, but just sort of the answer would be that if any patient or staff member is at some sort of risk, then we want to be involved, and we want to be helpful and aware. So it's really our duty to protect the safety of staff and patients. So if you're suspecting major depression or suicidal ideation, again, just like with our patients, we would just use our good intention, show that we care, and ask. So I've got a great video here actually from AHA. They made this about a year or so ago, and I thought it was a really good video. So maybe we could take a look at that. Kara is going to show us this first video.
We had a tragic incident in one of our inpatient units. It involved a night nurse, and one night during her shift, she reached a final crisis point. Her coworkers were unaware of just how bad things had gotten for her, but they noticed that something just didn't seem right, so they encouraged her to take some time alone, somewhere, having a moment of peace and quiet to gather herself, which she did. And shortly after, the unit's charge nurse found her in a supply storage area, having died by suicide. It was a shocking and traumatic event for all of us. Following the incident, we did everything we could to support the team, who was not only managing the loss of a coworker and friend, but also the pain of wondering what they could have done differently to prevent it. In fact, the CDC has identified that healthcare workers of all kinds work long hours and under difficult conditions, exposed to infectious diseases, and even violence from the very people they're helping. They're regularly exposed to real tragedy, suffering, and death. We work in a field that often centers around the most traumatic, painful, and frightening aspects of life. The very nature of what we deal with is life and death, and I think dealing with it has simply been a part of the job. It was expected, but we know better today. The American Hospital Association's Health, Research, and Educational Trust released a new guide that offers 12 evidence-based interventions for establishing or expanding a suicide prevention program. They're focused on reducing the stigma, improving access to care, and removing job stressors. A fundamental part of our culture at St. Luke's is that we believe it's just as much our responsibility to care for one another as it is to care for our patients. We provide an employee assistance program, but we go well beyond that. We provide education and support through webinars, on-site and virtual well-being check-ins, and consultations for our highest risk groups, nurses and physicians. Even before COVID-19, careers in healthcare were among the most challenging and stressful. These risk factors have never been easy to deal with on any level, but during the COVID pandemic, they were all significantly magnified, and there's no sign that this set of challenges will end.
So fantastic resources there available, and encourage you to check those out. And she even mentioned several resources as well. Okay, so moving forward, thinking about identification. So most of you are probably familiar with the surveys that are often used for assessing suicidal ideation and major depression. We usually use that for our patients, and we want to start thinking about those kind of signs and symptoms for each other. What I really also encourage is that it's not just leaders that are educated about signs and symptoms, but that we actually educate everyone. So I know that there has been a peer support program that has been quite successful by several hospital systems. I love that idea, and I actually would just take that idea a little further, one step further. So that program is about teaching sort of peer support people to identify people who may be suicidal or depressed. I actually would encourage that everybody get that training so that everybody is equipped to be supportive and to think about the stressors that are in healthcare and to watch out for each other. So I would just say, how do we train everybody to be a peer support and to know signs and symptoms? Additionally, if you do that training and everybody sees it, those that may be at risk will be more equipped and ready to know where the resources are and perhaps how to think about this and reach out. So response, there's lots of guidelines, as I mentioned, and AHA just mentioned one there. What you definitely want to have in your back pocket is sort of a very quick to-do list if you are in crisis with someone. So, know that you can, of course, always call 911, go to the emergency department. Who else do you need to call? Do you have a personal assistance services or an EAP that you would call directly? So I say this because when those moments happen to leaders, sometimes that very quick response has not always been there, and people get nervous and they're not quite sure what to do. So of course, never leave the person alone, and get professional help. I guess that is the main that I would like to recommend. And Kara, if we could watch the second video, and I will tell you that this second video is written for medical trainees, but it fits all of healthcare. And it's a video that I would encourage you to think about displaying. So any of these 3 videos that you'll see today, encourage you to use them perhaps with your teams, because again, it puts the thoughts out there. It decreases the stigma, which is one of the main goals with suicidal ideation in healthcare. I thought this was a great video, so hope you enjoy.
Medical training is challenging.
It can be frustrating.
Exhausting.
Overwhelming, especially when things pile up on you.
My marriage is coming apart. I took out $183,000 in loans.
I made a mistake, a bad one.
Sometimes I feel like I'm in over my head. I just don't feel prepared.
Sometimes I think the real mistake was thinking I could be a doctor.
We all have our ups and downs, but if somebody starts acting really down,
Not able to sleep or sleeping too much.
Shutting her friends out, giving her stuff away.
If somebody just doesn't seem like himself.
Not doing things he used to love.
Showing up late, not getting things done.
if somebody starts acting reckless or irritable,
Yelling at nurses, snapping at patients.
Drinking too much.
He might be feeling burned out, or depressed, or hopeless.
People who are smart and talented, they get overwhelmed just like anybody else.
And when they do, they may find it even harder to ask for help.
Medical students and residents have higher rates of depression and burnout than other adults.
they have a higher risk of suicide too.
That's something we all need to understand, the risks, and how to look out for ourselves and each other.
And when it happens, people say, I had no idea. I thought he was just upset.
I thought she'd get over it.
I wish he'd come to me. I
I wish he'd said something.
I wish I'd said something. And now it's too late.
Suicide can be prevented. If someone you know is acting differently or really down,
Don't assume he'll get over it.
Say something. Say, are you okay? How can I help?
The best way to prevent suicide is to show you care and get the person the help he needs. So don't be afraid to ask straight out.
Are you feeling so bad? You're thinking about taking your life?
People want someone to ask. They want someone to care. Faculty, peers, friends, anyone can ask.
Are you thinking about killing yourself?
And if she says yes, or maybe, or sometimes, here's what you don't say.
That's crazy.
One mistake isn't worth killing yourself over.
that's not going to solve anything.
What you do say is, I'm sorry you're feeling so bad. How can I help?
We'll get through this together. Let's get you some help.
Assume you're the only one who will reach out and get this person the help she needs.
None of us should be ashamed of getting help.
Getting help is the strong, professional thing to do.
Let her know she has options, that there are people she can talk to.
Let her know she can always turn to you. Make sure she has the National Suicide Lifeline number.
And help her find someone she can talk to. Someone who knows how to help.
Ask the Dean for Student Affairs or the Program Director.
If you think she's about to hurt herself, don't leave her alone.
Take her to the emergency room. Call 911 if you have to.
We all get down. We all have our bad days. But sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Are you thinking about ending your life?
Don't wait until you're sure. Trust your gut.
It never hurts to ask. It never hurts to care.
It can make a big difference.
Any one of us can make a difference.
All the difference.
In someone's life.
Okay, very, very good video. I would recommend, again, sharing that, just to remind people that there's help and you want to get help either for yourself or for somebody else. Okay, so now I want to think about how can we foster coping skills and, again, that psychological safety in our teams. And a huge part of my focus when I was at Duke was how psychological safety and stress and burnout impacted patient safety. So not only for the sake of our healthcare workers, but also then how that trickles down to our patients. So first, I thought I would just provide the emotional intelligence model. I am a real fan of the 4 boxes of emotional intelligence to use to evaluate what your team may need. So for instance, self-awareness. Are your team members even aware of their stress level? Are they aware of coping skills that are available to them for self-management? For relationship awareness, are they in the habit of sort of looking out for each other? Are there mechanisms and ways for them to do that? Have they been encouraged to do that? And then relationship awareness is, how do we manage conflict? How do we sustain relationships as contributors to health and well-being? So I really like the emotional intelligence model for so many things, to include evaluating your teams for what the needs may be. So an education curriculum, very similar to that AHA first video where she was talking about, in addition to having counseling services available, they had all kinds of webinars available. I was a real fan of offering that when I was at Duke, and some of the classes that I think are critical would be, of course, coping skills on stress management. What I loved about offering webinars on that topic was the allowance of staff who were attending to hear from each other, and even just to be part of the community of people that were also feeling stressed. So when in healthcare, we avoid talking about stress and burnout and struggles, we continue that stigma of mental health, and that as healthcare workers, we're supposed to just kind of stand up and move on. I think we've done much better about that stigma in the past many years, but it's still that kind of that attitude of this is, you know, where I am and what I do, and that tremendously stressful thing just happened and I need to move on with my day. And certainly that is often the case, but we also need to find ways to let those healthcare workers debrief and manage that stress and increase their coping skills. So training webinar, community type webinars where people can talk and interact, incredibly powerful for healthcare workers. Managing anxiety and uncertainty, kind of the same as skills for stress management, but a little bit different. It's around the anxiety symptoms and how to manage some of those sort of from a therapeutic standpoint. Change management, helping people to understand the stages of change and that they're very similar to the stages of grief, and how do you move yourself through those. Conflict resolution, that was one of my strong areas of interest. As we know, conflict resolution is a huge contributor to sentinel events and errors, but also a huge contribution to depression, burnout, lack of belonging in the workplace, particularly in healthcare. So very much believe that healthcare institutions should have some kind of education program that absolutely includes conflict resolution. Building and sustaining relationships, as I said, and then emotional intelligence sort of ends up being an umbrella to all of those topics. So really a believer in having very short 30-minute, maybe 45-minute, but 30-minute programs that are offered very frequently throughout the year, you know, 1 or 2 a week, again, for 30 minutes, and on a variety of different topics that are just readily available, you know, one Zoom link and everybody can just click on it, no registration, all of that. So I think that can be a way to make a successful education program that supports your interests in decreasing depression and likelihood of suicidal thoughts. So helping an individual. So some of you had asked, you know, how could just as an individual we manage our stress better? How could we help other individuals manage their stress better? So I love talking about stress management and could do that for a couple hours. So I had to narrow that down to one slide. But helping an individual and really your teams and sort of training them to manage challenging moments in healthcare. One is creating a personal debrief. So we're in healthcare getting better at having debriefing venues for staff who have experienced something very stressful. It's also so important for each of us in life to have our personal debrief sort of sequence. So that could be after a difficult day or a difficult moment, I may step aside for 2 minutes and do a short meditation. I may evaluate kind of what happened. Let me acknowledge where I am, my feelings. Let me take my 10 deep breaths, then let me go, you know, talk to a colleague. So some kind of debriefing sequence that maybe has 3 parts is critical to life. And of course, therapy itself is really sort of a form of debrief. Also really a big fan, just because it's evidence-based. So it's not just being a big fan, but it's evidence-based that certain style of deep breathing can be incredibly good for our mechanisms of safety. So you just want your exhale typically to be about twice as long as your inhale. Do at least 3, if not 10, or 10 to 20 minutes, whatever you can get. These examples here are really following the protectors of sort of protectors against suicide. So connection, talking to people, balancing focus, focus on the stressor with a distraction, moving. Again, that regular meditation, deep relaxation during feedback, flashbacks, and then journaling. So a lot of that is therapy, and certainly I encourage people to get therapy and to get help as they may need more. Here's the longer list. This is really a handout and a reference for you. So if you're sort of looking for how do I think about stress management, you've got your 5 major buckets, and then underneath those buckets are many different ideas. So therapy, again, I'm a mental health therapist for ThriveWorks, so I'm just all about people getting additional help for, again, traumatic events in healthcare or just managing stress in general. So for your teams specifically, a couple of things. I would really think about how can you get stress management and debriefing into venues in the workplace. So I know several clinics had relaxation rooms where there was music, there was a visual of the ocean, there were opportunities on the computer to look at ocean sounds, and taking moments to debrief and having an actual room to do it can be extremely powerful. Making sure that staff are aware of changes coming up, that communication is strong, because the unknown is what is uncomfortable for us. So that regular, comfortable communication with our staff so that they're not sort of caught off guard. Helping staff to self-monitor and utilize those stress strategies. And we'll talk about huddles in a few moments, but how can you keep the learning from the education program, for instance, how can you keep that in the conversation, in your huddles, in your agendas for your staff meetings, in your rounding with your employees, so that it becomes a normal part of conversation, that the education and learning about stress and coping is just a continued part of the culture. I do like to help people, whether it's individuals who are depressed or teams, to think about stressors from a standpoint of degree of control and predictability, and always helping teams to think about what can we control, what can we not control. For those things that we can't control, how do I tolerate it, or how do we tolerate it? For those things that we can control or I can control, what will we do about it? So this one slide is one that I have probably used in almost every presentation I've ever done, whether it's stress management or team. So encourage you to sort of help your teams think through this. And all of these ideas are related to how do we help our teams, how do we help our individual people who are at risk to feel in control, back to all of the Maslow's hierarchy. How do we feel certain? How do we feel confident? How do we stay connected to our colleagues? This is a slide that, again, is another reference, but as I think so often about conflict resolution and how many times I have worked with a stressed healthcare worker and it was related to a lack of sense of belonging, a really uncomfortable conflict, and how uncomfortable staff members can be. And if they're already vulnerable and don't have great coping skills and are dealing with the stress of healthcare, we would certainly want them to have as much support around them from their peers. And when conflict is in place, we start to focus in on what's most dangerous, which could be that one conflict, and we start to lose sight of the support that's all the way around us. And so again, I just kind of emphasize the importance of building and sustaining those relationships. This is a wonderful handout. It's a model Connect, Care, Close. You'll see that the conflict management one was on the same lineup of Connect, Care, and Close, but teaching people how do you make sure you connect when you first see people, when you first see them in the morning, when you first greet them, how to be emotionally intelligent and be aware of other people. How do you be aware of other people's stress? How do you own your part in building stress? And then in closing, how do you end the day with lots of thank yous? So this slide alone, you could print and copy, you could post it somewhere as reminders of how we need to be with each other. So again, as we look at the protectors or the contributors to major depression and anxiety and suicidal ideation, we know that connection is a huge component to that. So just emphasizing that again, and however you can bring it and build it into your conversation is critical. So fostering that connectivity. So in your settings where you have huddles, I encourage you to start to or continue to reduce that stigma of talking about feelings and concerns and worries and sentinel events and mistakes and those things that healthcare workers tend to walk around and carry with them, and then perhaps carry them home and keep them in their heads. I can't tell you how many people and healthcare workers I have debriefed after a mistake or a conflict at work, and how incredibly difficult it is for them to go someplace to actually talk about that. So reducing the stigma of getting help, talking about feelings can happen in your huddles. It can happen in your rounding with people, and we'll talk about that in a few moments as well. So huddles, positivity, affirmations, resources, continuing to build on those coping strategies, building buddy systems. So again, I'm a real believer in peer support and buddy systems, but that everybody is aware of how to be a peer support. A buddy system, that is something else that a few systems I'm aware of have used, where you just connect people. Maybe you connect two people and say you're each other's buddy for a month, and encourage them to do random acts of kindness towards each other, or check on each other once a week. How's your week going? And then you could switch up different buddies as time goes on. Of course, you would want to do that by volunteer, but what a wonderful way to connect people and various different people in a supportive model. Modeling, encouraging sharing of feelings yourself. So if you are a leader on this call, then talking about your own feelings and starting to make that happen. This last video is about 1.5 minutes long. It's kind of a cute video, and I certainly don't think of any bit of difficulty in mental health as cute at all, but in light of trying to give you some resources of things that you might share, this is a video that is created for healthcare workers as a reminder to share feelings and to make that okay. So just enjoy this, and hopefully it can let you share with others.
Life as a paramedic, it's a madness. Just finished work, they call me deep sadness. Caught a cot death on a final call. In the staff toilet, I bawl and bawl and bawl like a train. Like Justin Timberlake, red eyes and my guts are in a state. But I'ma keep going cause I'm no shirker. Let me introduce you to my co-worker.
They call me dead numb. Just got off shift and it was bedlam. Sleep would be nice if I could get some. But those tears in her eyes, they play on my mind. And I can't seem to find anything inside. Even though I try, I got no tears to cry.
You're feeling your feelings.
Actually, I'm not.
There's a feeling you feel.
I don't think she's even like listening to you.
No, you don't need to hide those feelings inside. Cause a feeling's just a feeling. It's okay to feel the feelings you feel.
I'm the jangle clanger, that's who I be. And when a call comes in, it jangles me. Now the day is done and I should be relieved. I go back home but never really leave.
I'm Dr. Rising Dread. I feel sick to my stomach when I lie in bed tomorrow morning. Forming in my head it says warning, warning, code red.
My name is powerless and I've lost control. I don't know what the plan is. I'm feeling so helpless that I cannot even choose a sandwich.
You're feeling your feelings.
I don't wanna feel them.
And your feelings are real.
I feel physically sick. I know you don't need to hide.
Oh no, those feelings inside.
So many
Cause a
feelings.
feeling's just a feeling.
It's really starting to get on my nerves.
It's okay.
might be misplacing some anger.
Yeah, I think we need some actual help.
To feel the feelings you feel.
Okay, so you could show that, and you could just in a meeting or a huddle, or if you were to email it to folks, you could just kind of ask, what point is this video trying to make? And the point, of course, is we're gonna struggle, and we're gonna struggle at work, and particularly in healthcare, and to know that that's normal and that there is help. So kind of the point of that video really was to show it to you, of course, but to offer you perhaps a video that may be helpful in sharing with others. All right, so another really, really important, and this is kind of obvious, but is rounding on staff. So as leaders, it is perhaps rounding on your staff about those safety mechanisms that contribute to suicidal ideation if they are strong or not strong. So as you round on staff, if you do monthly roundings or however your rounding schedule is making sure that you get to each staff member kind of regularly, but also looking for those staff members that may need a little bit more. So when you round, you may be just asking about their stress level and how they're doing. Check in with their relationships. You want to keep a good pulse on the climate and the relationships amongst the staff, because again, that increases burnout incredibly. Feeling of protection, just sort of how secure are they feeling? Do they need extra training? Where are their nervous points and anxiety points? Ensuring a sense of purpose, and this is really not just for rounding. That sense of purpose is what you want to connect and tie to everything that your team does. Asking about their need for support, whether it's at work or otherwise, kind of offering to everybody, look, it looks like you're doing great. I'm glad that you're shared, you're doing well. Just want you to know about great resources available to all of our staff. Ask them about how the stress strategies are going. So if you have a stress management program that you've offered, or that one of your colleagues in your healthcare system have offered, ask them, gosh, have you done that deep breathing? I've been doing it. It's been really helpful. Talk about recent events. So if there has been an event in your unit or your area, asking how they're doing, perhaps after you may have had some kind of debrief, and then just their sense of connection with the team members. So again, keeping an eye on the climate, keeping an eye on individual people, and making it a norm that you are checking in with them about their stress levels and their needs. All right, last section here is kind of the most important. This is sort of the prevention that you create in your team environments for psychological safety. So that role clarity, and the reason I say role clarity is so important is because, again, this is how we prevent that conflict management. And a lot of your performance improvement mechanisms that are in place are a part of this, and a great contributor to the reduction of stress and conflict. So this is a very, very simple activity that I have done for years and years with groups of 300 and groups of 3 people. And it is the simple way of finding out where are the stressor points and the pain points for each of your professions in a particular area. So you can ask each profession three questions. What can we offer? What do we need from you? And what do we need you to know about our stressor? And then what do we appreciate? Very easy meeting, and you'll come out with people having a much better understanding of each other's stressors and how they can support one another. And you'll end with a sense of appreciation from each profession towards each other. I am also a huge believer in briefs. Briefs are the way that we can, again, establish those roles and that clarity and that comfort. And I will tell you that I used to sort of prescribe briefs to many, many providers and the clinical staff that supported them, as an example. And I know briefs are team steps, and most healthcare systems have some form of briefs. But this is more than just the formal briefs. This is kind of the informal briefs, perhaps between two people or a smaller group that they create their own briefs. Perhaps in the middle of the day, for instance, office staff may come together at noon and kind of figure out where the work flow and who sort of needs to jump on what. So that is wonderful for relationship management, which we know is so important. And then debriefs, tremendous. I'm even more of a fan of debriefs than briefs. And the debrief can include debriefs after stressful events, the loss of a patient, the loss of a colleague, other types of super stressful events. You want to have some kind of system in your healthcare system for debriefs. And that could be an entire program of people that are volunteers to help do debriefs. And lots of healthcare systems have those in place. But debriefs are the place that allow healthcare workers to manage their feelings after a very difficult event. And that could also include a mistake. It could include an unexpected death. It could include an error that led to a significant loss or not. So all of the events that could potentially really impact a healthcare worker long-term can be very well supported in a debrief. And so I was on a volunteer unit for that and really enjoyed that work and helping people to get through that moment, but then also making sure they're in counseling afterwards. And of course, that's what I'm doing now, to manage the feelings of the aftermath of difficult events in healthcare. Just curious how many of you have done debriefs in your past, and we don't have enough time for a long conversation about it, but I'm going to let you answer that as I sort of continue to talk a little bit. And then we'll look for some of the themes of how many of you have actually conducted an emotional debrief. So there are lots of tools and lots of guidelines on how to do emotional debriefs. I would really encourage that you get at least one mental health professional to join you in your debriefs. I think it's wonderful to have leaders a part of it, and then joined with an experienced person to do emotional debriefs. And I've seen different healthcare settings do this differently. Sometimes they only have mental health professionals conduct the debriefs. I've had or been aware of other healthcare systems that have mostly volunteers do the debriefs. And so lots of combinations of opportunities for how to do that. And then again, lots of resources available for how to do a good debrief. But this is really critical because this is the kind of events that can get locked in people's heads as forms of PTSD, flashbacks, increased anxiety disorders can get rolling. Again, depression, depending on the type of involvement that a healthcare worker may have had. And we know all of those emotions and anxiety systems and mental health problems can lead to suicidal ideation. And then the last most important is the facilitation of norms. And this is how we can prevent the bullying, the really bad behavior from one staff member to another that is sort of under that umbrella of conflict that I was mentioning earlier, and how we want to get in front of that. And the way that you can get in front of that is to help your team members make some joint decisions together about how they want to be together, right? And you can facilitate conversations about, how do we want to handle our own stress? How do we want to start to manage that better? How do we want to manage if one of us has, acted out of line? How do we want to have conversations about that? How do we want to make sure that we don't do that and make an agreement about how we approach each other? How can we put some education and system in place so that we can manage our stress better and manage our words with each other better? So the facilitation of team norms, I think, is so important, and I would be happy to share kind of a little set of guidelines on how to do that. I'd be happy to share that, and maybe we can, I'll talk with Jen and Kara about how to make that available to you. I'd be happy to share. So that is what I have for you today. Key takeaways is don't make it too complicated. People need to be asked. They need meaning and purpose and connection. Get people to connect with each other in a really safe environment. And then lastly, know your resources and sort of snap your fingers. You would know exactly what to do if a colleague or staff member shared potential suicide ideation. So I thank you so much for today. If we do have time for questions, I am right here. I'm going to stop sharing. And yeah, we're happy to take any questions for these minutes that we have. And otherwise, please reach out to me directly or Jen or Kara, and we will get your questions answered. We welcome that.
Awesome. Thank you so much, Sanne. I'll first start by saying that, and thank you for providing a really comprehensive overview, yet some really practical strategies and really wonderful resources. We'll be sure to share the slide deck, the videos, and then we'll connect with you on additional resources to share in a follow-up email to everyone. I think we're a little too tight on time within the next couple minutes to get to these questions are so important, and I would hate to not give them the time that it's really needed to give a good answer. So Sanne, we'll chat in. Kara, if you could chat in Sanne's email address, she shared them on the slides, but just in case anyone wants to reach out to you, but we'll work on getting some of these questions answered. And then specifically, just a few other logistical kind of operational reminders is that Kara will also chat in the phone number for you to text to get your CE credit for this time. And then the other kind of housekeeping item is to please, you'll get an evaluation that will pop up in your browser after we close out here. So we'd really appreciate you taking the time to fill that out. It really gives us good feedback. But again, we'll provide you all of the resources that Sanne has mentioned here in a follow-up email. But again, thank you for joining us on this really important subject, and for us bringing more awareness to suicide prevention, especially among our healthcare team members. And Sanne, thank you for all the work you've done and your passion for this. We really appreciate it.
Yeah, thank you. Thank you so much, everyone. And let me know if I can help.
Great. Have a great rest of your day, everyone.